Hey guys, it's me, Paige, and I'm joined with
Maddie.
So today we are going to be talking about her type 1 diabetes.
So we're just going to be talking about this, which is called a checker or a glucose meter thing. Yeah. So we're going to be doing this today, basically. You can go through the steps. Oh, and there's this, which it's also for diabetes. It's also for diabetes, except it's for your ketones, and that's just for your normal blood sugar. We're just going to be doing the normal blood sugar one today.
Okay, so this is what it looks like. So this is the reader thing. These are
Test strips.
And then this is the poker. So what you do is you take a sterile alcohol pad and
Wipe it on the finger that you are going to
yes,
be.
you wipe one of their fingers. And always do this first before you turn on your reader and everything, just like it can dry and everything.
And
then save it. Don't throw it away because you're going to want it in a minute, and you'll see why. So then you take a test strip.
And after this, I'm going to be doing her blood sugar after she does mine.
We didn't agree to that.
No, we did.
No. Okay, we're just going to put that in a minute. So you take a test thingy, and you put it in this.
Wrong way. Flip it up.
I knew that.
No, other way.
I also knew that. Anyhow.
There you go.
And it turns on.
Push it another way. Okay, that's good.
And then
once it says that, once it says put the drop of blood in.
So now, oh shit.
We just
change this. You pull that off
to get a poker,
and you get a needle. And you don't want to just pull this sideways because there's a needle literally stabbing up under that. So you turn it like this, and then you just pull up, and then.
Yeah, it's good.
I need a white background. So there's the needle. And then you push it in this.
Until it latches.
Yes, until you hear it click. And then you put the top in, the bobber thing on. I'm going to be very careful not to prick myself because I will literally cry. So, and then you lock it. So you just pull this thing back and it's loaded. And then...
And usually you should do the side of your finger.
Yes, you do the side of your finger.
If you do the middle, it'll hurt more.
So right there?
Yeah.
Like that. And then you can see.
And you get the blood out.
And
you just put it into the strip.
You just touch the strip.
With it, and it'll absorb the blood. And then this is why you want the swab after, because you want to wipe it, because... Yeah.
And then
you click.
It'll say these. You can pick one. We just do no mark. We click
and
it.
It'll say your
and she's
number.
158. So is that high or low for you?
It says it'll also say in range or whatever. So that one's, it says sending a pump, but then it'll say in range. So
yes.
Yeah.
And we'll send it to her pump, and then we just stab her for fun.
Oh my god. Well, now I definitely get to stab her.
No, you don't.
Yeah, I do. So that is how you do that. Now I'm just gonna be doing it to her quickly.
Don't put this back.
Because we're gonna do it to you.
No. And then.
Well, are you shaky right now?
No, because I just ate. So
well, then we should be checking the blood sugar.
I'm fine. So now we're going to check the ketones.
No, we don't. I don't need to check. So also though, you don't check ketones.
Well, that's what we said we were gonna do.
No,
so
we don't. You
just
can't check ketones. That's an expensive thing. No, I only check ketones if I'm 250 or higher.
So this is a ketone reader on which you are.
Pokey right there.
I didn't poke you right there.
Oh, it's right here. There's a lot of blood. Okay, you can keep going.
Okay, so we're going to check this one really quick. Now, this is expensive, so we're only going to do it once. We're not going to mess around. We're actually going to do it. So, yeah. What we do is this is a fresh pack of needles. So, we get one needle. I'm just going to open the corner. I'm so uncoordinated. And then get one needle. Excuse me. Excuse me. And these test strips look different.
Yeah, these are different because they're more expensive, so they are packed individually.
Yes.
And I'm going to be getting this. I'm going to be pulling off like I did with the last one. This is a kind of different one, but you still do the same type of thing. I'm going to be pushing this in, like so. I'm twisting the thing off.
And I do it a different way than she does, but
Just because she's not like...
I'm petrified of needles.
And then you're going to... There's different settings. Right now, if you look, it says 8. It says 8, but you want it at whatever setting you feel most comfortable at. And then I'm going to be using the alcohol swab.
I want to poke you.
Okay, I'm going to be using the alcohol swab. Okay, actually, I'll do it this time. Or you can test yours. Okay, then I'll do it myself. So you're going to also be using this alcohol swab. Okay, fine. You'll be using this alcohol swab to wipe off your finger and just let it dry.
So this is what these test strips look like. They're very different. So then this is the reader thingamabob.
Put it in the right way now.
So I put it in the bottom and it'll turn on. And I don't know how to work these.
You just wait till it. You have to let it turn on. No, leave it.
Okay, so now it's asking for blood.
It's asking for the blood droplets. So now,
so now we're gonna clean her finger again.
This finger, I already cleaned it.
Is there already a needle in there?
Yeah.
That's how much is gonna go in you?
Wait, what, is that even the needle? Oh. That would hurt. So we're just gonna be using this poker.
No, we're not.
Yeah.
I'm gonna go like this. I'm just gonna poke you and I'm gonna pull it right away.
No, I have to switch the setting on it.
Okay, so she's gonna switch the setting on it just because like, this one is different. So.
So if I switch the setting to one, it still goes up.
But it's not a lot anymore, so we're just gonna do it. Ready? So did you clean your finger off with an alcohol swab? So we cock and load it. By pulling, it's the same thing. You just pull this back. Put this one.
Yeah.
And I don't know why, but I like massaging it. I do this to her a lot when I poke her.
I'm gonna put it where I need to poke it because if you put it, and you have to like just press the button. Okay, now press the button.
I want to hold it. Let go.
No, you're not holding my finger.
Let go.
Okay, now press the button. You can't hold my finger though. I'm not holding.
Okay, I won't hold your finger. Right there?
No, Paige. Okay, right here. Now go. Okay, and then you're gonna get the blood. And then right now, it's asking for it. And this one, you need to like get more blood on it. And you will have to squeeze out more probably, whatever it asks. And then it will say 5, 4, 3, 2, 1. And once it is done reading, it'll say how much ketones you have. Right there, it says how much is left. 4,
Can I
3,
poke the pumpkin?
2, 1. Sure. And I have 0.1, which actually is not good for 158. But usually you don't test your ketones unless you're 250 or higher. This just means that I need to drink more water, and I don't have like enough water in my system. And yeah. So that's...
I felt me pull out of the pumpkin.
And so that's how that goes. And yeah, that's it.
Look it, now it's not even coming out.
Yeah. Okay, so that's basically it for this video.
And stay tuned. I almost just poked myself. That would not have been lovely. So stay tuned for part 2. We'll be talking about her Dexcom reader on her arm and insulin.
Bye.
So thank you all for watching this video. We hope it helped you if you're just learning that you're a diabetic or you need help with using something. So yeah, we hope this helped you.
Bye.
Bye.